Hello everyone, and welcome to the 8th Talking Tuesday video series where we review frequently asked questions and topics specific to health links and coordinated care plans. In this session, we'll be talking about the transitions in care in the coordinated care planning process. The first frequently asked question is what types of transitions might happen during the coordinated care management or CCM process? Multiple transitions may occur during the coordinated care management process and while utilizing the coordinated care plan tool. Since it is an evolving process, we would expect changes and transitions to occur naturally. Let us go ahead and review the various types of transitions and when to expect them. A transition may occur when there is a change in the client's health status, as this may result in a change or adjustment in their goals, or a change in the services and the service providers that they may require. When a client begins to reach their original goals, new ones may be created, which may require transition to a new integrated care lead and or a service provider. A client may transition to self-care management when they are independently managing their own care, have met their goals, and no longer require multiple service providers. If the client's goals no longer align with the services of the integrated care lead, then a new integrated care lead should be identified and informed, and a warm transition should occur. And just as a note, a warm transition or handoff is a handoff that is usually conducted in person between service providers with the client present in the discussion process. This is very important as communication breakdowns can often result in duplication of services, silos between partners, the client feeling lost in their care journey, and providers being misinformed of the client's health status. It is important that you engage the client and their family during this time and encourage them to ask any questions that they may have. Allow the client to clarify or correct the information exchanged. Another type of transition is if a client or the client's substitute decision maker decides to withdraw from participating in the coordinated care plan. Lastly, if a client has moved outside of the H&HB LIN, or if they are deceased, then a coordinated care plan would need to be transitioned. The next frequently asked question is when do you transition a client? So as a service provider and care team member, you will frequently be assessing the client's readiness for any of the transitions we had just reviewed previously. Assessing readiness for a client's transition is an ongoing process, one that should be discussed and done in collaboration with the client and other care team members. If a client has met their goals, has a change in their health status, has identified new goals as previously discussed, requires a change in service, requires a new integrated care lead or care team member as part of the team, has moved outside of the LIN or region, is self-managing or has passed away, then a transition will naturally occur and will need to be documented on the coordinated care plan, the initiation or update form, as well as the consent forms. A care conference is highly encouraged to really ensure smooth transitions and that a warm handoff occurs between different care team members. The next frequently asked question is how are coordinated care plans or CCP transitions completed? When a transition seems to be approaching, begin having discussions with the client as well as other care team members to assess the readiness for transition. We highly do encourage a care conference with members of the care team as well as the client who is in attendance. The care conference will provide an opportunity to discuss the transition, define current and future roles and responsibilities throughout the transition, discussing next steps, plan for continuity of care and warm transitions, to identify new goals, and as well when a new ICL and care team members are needed. Ensure that there is a warm handoff to the new integrated care lead and any members of the care team present. It is really important that the integrated care lead is aware and has agreed to this role themselves. All members of the care team should be informed of the transition, and if a new integrated care lead has been identified, then care team members should be provided with the new ICL's contact information. The coordinated care plan will need to be updated to demonstrate any changes to the integrated care lead, the care team, the goals, and the transitions occurring. Utilize the patient agreement form to review the CCP process and provide the client with the most updated ICL contact information. The multi-agency consent form will need to be completed if members of the care team have been added or removed. If the client's CCP is available on HPG, then the multi-agency consent form as well as the initiation or update form will need to be completed and faxed into the LIN to demonstrate the transition and changes occurring, as well as to make the necessary changes in Health Partner Gateway. So Section A of the initiation or update form will need to be completed to identify the changes in ICL. So you can see Section A just up on the screen now. While Section C needs to be completed to demonstrate a change in status of the transition occurring. So here's the request for change of status of the CCP. The next frequently asked question is ensuring a warm handoff process during CCP transition. So this is more of an FYI. Some last thoughts to consider during a CCP transition to ensure that a warm handoff process happens for everyone involved is to conduct a care conference or joint visit. Make sure there's clear communication amongst everyone on the team, including the client. There should really not be any surprises for them. Clearly identify and communicate next steps and plan for continuity of care. Remember to communicate and involve the primary care provider. Make sure there's a safety net in place to allow for support of the new integrated care lead. That includes access to care team members for support and problem solving. Ensure that each member of the care team is committed to continue to support the client in achieving their goals through the actions as outlined in the coordinated care plan. And lastly, we'll be going over some key takeaways from this session. Care team members are encouraged to frequently assess a client's readiness to transition throughout the CCP process. This is an ongoing process that is really meant to be involving with the client and their coordinated care plan. It is encouraged to conduct a care conference or joint visit to assess and discuss upcoming transitions, and this will really assist in preparing for next steps while ensuring that a warm handoff for everyone involved. Consider transitioning a client when they have met their goals, have had a change in their health status, they have identified new goals, require a change in service, require a new integrated care lead or care team member, have moved outside of the LIN region, are self-managing, or that they have passed away or deceased. Update the coordinated care plan and the patient agreement form. Provide a copy to the client with the new integrated care lead's contact information. When using HPG, update the consent form and the initiation or update form and fax them into the LIN. And lastly, communication is key to a successful transition. Thank you very much for tuning in to Session 8 and stay tuned for Session 9.